The Centers for Medicare and Medicaid Services have issued new guidance on hardship exemptions from having insurance. This guidance came down September 12th. It's guidance that makes it easier for taxpayers to claim a hardship exemption. We'll talk about what hardship exemptions are to refresh our memory in just a second. Let's keep talking about what this guidance says. It's really pointing to just the coverage year of 2018. It's guidance that's meant to just cover the coverage year of 2018 and nothing into 2019. And we'll talk about that timeline in a minute. So let's look at what happens. The guidance says if you did not have coverage in 2018, when you file your taxes in 2019, you could be subject for the penalty for being uninsured, but you can claim a hardship right on your taxes without proof, without verification of what the hardship is, and you're going to be fine. You don't have to do verification. You don't need a written explanation. You can either say, I was uninsured and I want to pay the tax penalty, or you could say, I was uninsured and I want to claim an exemption for hardship for being uninsured, and you're done. And like we said, it's valid only for 2018. Let's first refresh our memory on what hardships are. These are the financial situations or other circumstances that keep somebody from getting health insurance. Now, under the Affordable Care Act, if you don't have health insurance for over 3 months during the coverage year, you're subject to that tax penalty for being uninsured, part of the individual mandate that says you have to have coverage or pay a penalty for not having coverage. There's a little grace period in there for you to connect to health coverage or find a minimum essential health coverage. If not, you pay a penalty. Hardships excuse you from that penalty, but they typically fall in one of 14 categories. And this was you were homeless or evicted or facing eviction for a period of time. You had other circumstances going on that so impeded your ability to go purchase insurance at that time that you're excused for those months where that was impacting you. You could actually be excused for the whole year in most circumstances. You received a shutoff notice from a utility company. So you can see the direction these hardships were going. There were enough life circumstances happening that connecting to coverage at that time was not going to work for you. You were experiencing domestic violence. You had a death of a family member, a disaster, bankruptcy. So these are their more extreme examples of why you couldn't purchase insurance. For little examples of why you couldn't purchase insurance, they don't count. They typically haven't counted. So enter some guidance in April of 2018 where the administration tries to broaden out hardship exemptions and make more things apply. They try to make it a little bit more generous so people could get a hardship exemption. And then enter the new September 12th guidance that says, just check the box and you're done. So we've seen this broadening over time of hardship exemptions to keep people from having to pay that penalty. Well, this fits into the overall timeline, and this is why it only applies to 2018, of what this administration has been trying to do. Remember, the GOP tax bill that was signed into law gets rid of the penalty altogether. It zeroes out the tax penalty for not having insurance. But that's not until coverage year 2019, and then you would have $0 when you reconcile your taxes in 2020. No penalty for being uninsured in 2019. But if you're uninsured in 2018, there is a penalty for being uninsured. So because the tax bill doesn't take effect until that coverage year 2019, this guidance is meant to cover people now. So it's going to catch those people that are uninsured in 2018. Now, the intent, as most people are affirming, is to chip away once again at the individual mandate. You know, this might actually be nice for some people that won't be surprised with a tax penalty come tax time because they didn't have insurance in 2018, but what it's really doing is excusing people from being covered. It's chipping away at that idea that we work better in insurance when we have more people in it and we can bring down costs, bring down premiums, increase participation, increase health. This is saying, we're going to keep chipping away at that rule that you have to have insurance by getting rid of all of the penalties for not having insurance. This is going to pull, as some health policy experts have told us, healthier people out of the marketplace. The people that think, I don't need the insurance, I'm going to be just fine, and now I don't even have to worry about paying that $695 tax penalty. Now I could just check the box and I'm good. Seema Verma, CMS Secretary, said today's announcement shows how President Trump's administration is working to ease the burden of Obamacare. So this is why they think this guidance is appropriate to essentially wipe out hardship exemptions as strict as they were and open it up to just about anybody without proof. They didn't do that by executive order. They didn't do it by legislation. They did it by guidance. And her wording is pointing to that executive order that Trump signed very early, his very first day in office, that says we're going to do whatever we can across federal agencies to ease the burden of Obamacare. So this language that Seema Verma used in her quote to the press is connecting this guidance back to that executive order, therefore making it okay, and it is now implemented. So by the time you file taxes in 2019 for 2018 coverage year, you will see the hardship exemption listed on your tax return, and you can check that box and you're done. You can read the guidance for yourself. Coming out of CMS, you can also read the CMS press release that kind of boils it down and summarizes their intent and has another couple key quotes in there. And you can also read a couple newspaper articles that are looking at this in much more detail. If you have questions or a healthcare story, if you think hardships exemptions should continue the way they have in the past, you can send us an email, you can watch more videos, and you can do all of that at healthwatchwisconsin.org.